Okay, let me ask you something. Have you ever tried to get a copy of your own health records? If you have, you probably know the feeling. Wading through a sea of paperwork, endless phone calls, and maybe even, I kid you not, a fax machine. It feels like our most important information is just trapped in the past. But what if I told you that's all about to change thanks to a massive digital revolution that's happening right now? Right? That feeling that your own health information is being held hostage, it's something almost all of us can relate to. I mean, it's your data, but getting your hands on it or just trying to get it to a new doctor can be so incredibly frustrating. The good news? A huge change is finally on the horizon.
And this isn't just some wishful thinking. The US government has actually stepped in. This quote here from the Centers for Medicare and Medicaid Services, or CMS, basically says it all. They've acknowledged the system is broken, and they've put a new rule in place to fix it. And we're not talking about a small tweak here. This is a fundamental overhaul of how healthcare data moves in America.
So, to really get why this is such a big deal, we first need to appreciate the scale of the problem. Let's dive into what I like to call the data maze we're all stuck navigating. Just think about it for a second. Your family doctor has some of your records, your specialist has others, your insurance company has all the claims, and none of these systems talk to each other. They're all in their own little silos. This creates this messy, fragmented picture of your health, which leads to frustrating delays. And every time you switch your insurance, it's like hitting the reset button and starting from scratch. It's inefficient, it's expensive, and honestly, it puts patients at risk. So, what's the solution? What's going to untangle this mess? Well, it all comes down to a powerful new federal regulation. In 2024, CMS issued this new rule, and it is a total game changer. It basically mandates that major health plans, we're talking Medicare Advantage, Medicaid, and more, they have to upgrade their technology to make your data accessible and easy to move around. It's not an option anymore, it's the new law of the land. Okay, so how does this big tech upgrade actually work? Well, it's all powered by a brilliant standard with a pretty cool name, FHIR. So FHIR, and it's pronounced fire, is basically a universal translator for health data. It's a really simple but powerful idea. It doesn't matter if one hospital system was built in the 90s and another one was built last year. FHIR creates a common language they can both understand, allowing them to talk to each other. And this comparison just nails it. The old way was like having a drawer full of random mismatched chargers. Nothing fits. The FHIR way is like everything finally standardizing on USB-C. All of a sudden, everything just connects. Your data can move seamlessly from your doctor to your insurer to an app on your phone, and it can do it instantly and securely. So FHIR gives us the language, but how do we actually open the doors to let the data flow? That's where something called an API comes in. You can think of APIs, or application programming interfaces, as secure digital doorways. This new rule requires 4 really important ones. The Patient Access API puts your health data right on your phone. The Provider Access API gives your doctor the whole picture. The Payer-to-Payer API means your history follows you automatically when you switch plans. And my favorite, number 4, tackles that huge headache we all despise, prior authorizations. It makes them digital and way faster, which means less time waiting for the care you actually need. This all sounds great in theory, but what does it actually mean in the real world? Well, the impact is staggering, and it all boils down to a massive efficiency upgrade for the entire US healthcare system. The government itself estimates that by digitizing all of these old-school manual processes, we could save over $16 billion in just 10 years. This isn't just about making things more convenient. It's about reclaiming a truly colossal amount of wasted time and money from the system. So where do these massive savings come from? Well, this slide breaks it down, and it is eye-watering. Right now, the average doctor's office spends over 700 hours a year, that's 18 full work weeks, and over $50,000 a year just chasing down paperwork for prior authorizations. Digitizing this one process frees up doctors and nurses to do what they're actually supposed to be doing, taking care of patients. And for you, the benefits are huge. We're talking faster access to care. We're talking about your doctor making decisions with your complete history right in front of them. It means you are finally in control of your own health information. But think even bigger for a second. This creates the foundation for a whole new wave of innovation. Health apps that can help you do everything from managing a chronic condition to focusing on preventative care. Okay, so this future sounds fantastic, right? But the big question is, when is it actually happening? Let's take a look at the timeline.
This isn't some far-off dream. These deadlines are set in stone. By 2026, those awful prior authorization delays are going to start shrinking. And by 2027, the entire system of APIs, all those digital doorways for your data, has to be up and running nationwide. Now look, this is a massive undertaking. It's kind of like upgrading the entire operating system of American healthcare. It's not going to happen overnight with the flip of a switch, but the process has already started. The mandate is in place, and the technology is ready to go. And that brings us to the final and most critical question. For the very first time, your complete health history is going to be at your fingertips. This new rule literally puts the power in your hands. So as we step into this new era, the real question is this. Now that your data is finally unlocked, who are you going to trust to help you use it?